So good evening, everybody. Welcome to our session this evening, which is Back to School COVID Safety, where science meets in-person learning. We're going to go ahead and get started with the slide presentation. So the first thing I'd like to talk about is some housekeeping items with you. And unfortunately, I'm not seeing the housekeeping items on the screen at this point. So the first thing I'd like to share with folks is that at the bottom of your screen, you have the capacity to turn on closed captioning for those who are, for whatever reason, unable to hear the audio or benefit from closed captioning. I also want to ask everybody to continue to realize that your mics are muted. So if you have any questions during the event, please feel free to type those in the comments section, the chat feature of Zoom. We have a team of people who will be monitoring the chat and trying to synthesize the comments and the questions. And so you can either type in your comments, your questions in the chat. And there's also a question and answer button that's available to you if you'd like to use that as well. So I'd now like to transition to our next part of our presentation, which is our introductions. So I'm going to start by introducing myself. I'm Erik Porfeli, Department Chair and Professor in the Department of Human Sciences. For those of you who aren't familiar with the department, we are basically four things. We are the basic ingredients of your health and well-being. We are what you move, what you eat, how you relate to others, and how you manage your resources. In other words, we are kinesiology, human nutrition, consumer sciences, and human development and family sciences. And collectively, we work in our communities and around the world to understand the vital ingredients of health and well-being and how they manifest in people and in families, which positions us well to have panels just like the one that you've joined tonight. The one that you've joined tonight really focuses on two aspects of what we're facing as a community, as a state, and as a nation, which is how do we return to school in a safe and productive manner within the context of COVID, and what does science and in-person learning suggest that we ought to do to remain safe and to remain engaged and to support our children doing the same within the context of their education. So with that said, I'm going to now introduce our two panelists. Our first panelist is Sanja Ilic. Sanja is an associate professor and food safety specialist in the Department of Human Sciences at The Ohio State University. The focus of her research is in investigating and promoting food safety, reduction and prevention of food safety risks among consumers, food handlers, and populations at risk, including populations with chronic diseases, which we know is a risk factor within the context of COVID. Dr. Ilic investigated food safety behaviors with the goal of determining the barriers to food safety interventions, and she uses formal knowledge translation to move research knowledge into practice. Her research provides novel food safety interventions. Welcome, Sanja, and thank you for joining us this evening. Our second panelist is Dr. Charlie Keenan. He is a school superintendent of the Maple Heights City Schools in Northeast Ohio, not too far outside of Cleveland. He has served as public school students in Ohio for over 30 years. He is entering his 17th year as the superintendent of Maple Heights City Schools. He must not like to sleep all that much. Dr. Keenan graduated from The Ohio State University with his bachelor's degree in education in 1990 and went on to receive his master's and doctorate degrees in education administration. He also served for 11 years as a high school principal in 2 urban school districts. He's presented professionally throughout his career at national, state, and local events, and has been nationally recognized for his leadership. He currently serves as the president of The Ohio State University College of Education and Human Ecology Alumni Board of Governors. We thank him for his service, and we certainly thank him for joining us this evening. So now, you're welcome. Welcome, Charlie. So now we're going to go ahead and transition to our first question. Before we do, I'd like to thank some folks before I move into the questions. Firstly, I'd like to thank the College of Education and Human Ecology Board of Governors. This is our board of governors that provides advice and counsel to our college around issues that strengthen the fabric of our college and help us advance our mission. They are the community leadership that guides us into the future and helps us tackle very pressing and important challenges like the COVID-19 pandemic. And Charlie's presence tonight is an illustration of that. I'd like to also thank our Dean, Don Pope Davis, for hosting the event. I'd like to thank our EHE Office of Advancement. Many of those folks are working behind the scenes as I speak to make sure that we have a fantastic event. I'd also like to recognize Ohio State University Alumni Affairs. They too are working right now behind the scenes to make sure this event comes off smoothly. And then finally, and perhaps more importantly, most importantly, I'd like to thank all of our community partners for a couple things. Firstly, if you had a chance to watch our trailer video for this event and had fun watching it like I did, it was actually people in the community that provided input about how to create that trailer video. We also asked all of the attendees tonight to provide questions to us. And before the event, we received nearly 50 questions from folks who registered for the event. And we used those questions to formulate the questions that I'm going to use in engaging with the panelists. So thank you for those important questions. And also thank you for attending this event tonight. I'll finally share with you my favorite question out of all 50. The question was, they wanted to know about everything, ? And I love that question because it really signals how much we're all wrestling with the uncertainty of what we are currently facing and what we might face into the future with respect to COVID-19 and how it translates into the learning opportunities and experiences for our children. So with that said, and without any further ado, I'm now going to transition to our first question. And this question will be addressed to Charlie. So a new school year generally brings a mix of excitement and anxiety for everyone involved. That's including parents and children and teachers, and certainly superintendents. The pandemic has clearly amplified these feelings, especially to the extent that COVID-19 pandemic brings a new level of uncertainty and fear into the mix. Charlie, could you share some perspective on what we can expect in the coming year in our schools and how to best prepare our children, parents, and school staff physically, intellectually, and emotionally?
Sure, that's a great question. And there's a ton of emotions that were wrapped into that statement. And that's really, I think, what everyone's experiencing right now. Everything from excitement to fear to anxiety. And as you said, all the stakeholders from students to families to staff and even superintendents, struggling with the uncertainty of what's going on. From a school perspective, the one main thing that's going to stay true for us is we're going to focus on educating our students and finding the best way to provide supports and instruction and high quality learning for our kids. And so we really want to keep that as a focus. But in this time, it's very important that we rely on the healthcare experts to help guide us on how to navigate through the things that we're dealing with. And I think I'll turn things over now to Sanja because she's the expert in that area and she can talk a little bit about some of the health concerns and what we'll be facing here in the near future.
Well, Charlie, thank you very much. This is a little bit about how I feel as an expert. Actually, I'm a parent first. And so I saw somebody posting this on a Facebook in our parent group, and this is exactly how I feel. And I was just like the next parent puts into this dilemma whether to keep the kids at home, whether to send them online only, or should I opt for hybrids and what to expect. So I really understand how that feels, and even as a teacher, we're preparing to go on online and hybrid options for our students. So I understand there's a huge learning curve. And finally, as a scientist who has a little bit more insight in infectious diseases, I understand that there are so many factors to consider, and so there's really, it is not surprising that we are feeling anxiety and that we're confused. And in epidemiology, we like to look into diseases from this point of view that any disease, whether the disease is going to make somebody sick or a population sick, will depend on this interplay of triad, the triangle between the pathogen, the host, and environment. And pathogen, obviously, at this point is COVID. It's a new virus. We know some things about it. We do not have the vaccine yet. We are working on it. There's a lot of unknown surrounding the pathogen. Then host, this is us. This is going to be a number of factors that could predispose some get sick, like demographics, like age, socioeconomic status, underlying conditions, overall health, and then environment. And we know we're talking about school as an environment. School can be a challenging environment when it comes to controlling any infectious disease. It's a location of crowding, and children, especially at the younger age, where their behaviors are not yet at the level that they can fully control the transfer of diseases. But not only school, the kids that are going to be in schools are going to be also in their home environment, in their sport practices, etc. So we have to take all of that into consideration. As you can see, this is a complex triad, and definitely reason to be a little bit confused. Now, on that note, physically, as you sorry.
It wouldn't be a Zoom meeting if a dog wasn't barking, right, Sanja?
So physically, we definitely need to make sure that we are maintaining our health and maintaining our immune system in good health. So eat well, eat healthy, plenty of physical activities, keep yourself fit and well. Intellectually, it is important that we really understand the reasons why we're doing and why we're implementing some measures that are going to be critical in the school environment. And we need to understand that there will be a lot of times when we have to cut each other a little bit of slack, and understand that there will be a lot of challenges that we have to face.
Thank you so much, Sanja. So I'm going to transition to the next question, and maybe Sanja, you could start this one, considering that it relates to some of your work as well. So the next question is, what modifications to the buildings and spaces should take place before the students return in the buildings? And I'll just, as a contextual piece, I'll share that many of us as educators and as parents and as even former students know that we've had many different kinds of outbreaks, most commonly the flu, and schools have to do things within the physical environment to cope with that, especially when the flu spreads very fast into a large number of folks. So at least we have some experience in that arena, but you know, this COVID situation is new for all of us. So anything you can share in that vein, Sanja, would be wonderful.
Well, sure. Although my expertise is in more of how the pathogens move around, there are definitely some things that should be done to prepare the students and staff and the teachers as they're coming in. Definitely physical distancing is important. So the schools are already announcing, and many many programs are flexible, and they're de-densifying the number of students they're sending. So making sure that there is a space to accommodate different sizes of students groups. It is really important when we're thinking about buildings as well to make sure that we fully understand what the student flow is going to look like in this new situation. So there is going to be one entrance, one exit, where the groups of students are going to cross paths. This is going to be really important to ensure that minimal contact between different groups of students. And I would say probably most challenging, I'm not really sure, this is going to be very dependent on school district, on each building, is to control a little bit of airflow and air quality in the schools. And I think this is going to be maybe where the schools are going to be having to invest a little bit more resources, in addition to just making sure that the flow of children and flow of staff is appropriate to prevent transmission.
Thank you, Sanja. I mean, I think that certainly your guidance there certainly acknowledges the airborne nature of COVID-19, that it's airborne via very, very small, can't even see them, water droplets at times that carries the virus. So thank you for those general principles. Of course, Sanja also shared that despite the general principles, the rubber meets the road in real buildings with real people. So Charlie, anything you'd like to add with respect to modifications in buildings and spaces?
Yeah, sure. The one thing I'd just like to qualify before I get too far to, talking tonight is, I'm a superintendent representing one district. And so I can share my individual perspective. I can try my best to share in general what superintendents and districts are trying to do. But, I'm sure all the viewers know that right now, the reopenings of schools is a local decision. And so there's not been state mandates as to what we all need to do. And it's really done that way because of some of the things that Erik just said. Each building is different. The size of districts are different. Whether you're in a rural area or you're in an urban center, those things give us some flexibility to really make sure that we're, hearing the guidance that, Sanja just gave us and applying them to specific buildings and facilities as best meets the need of that community. So there's not really one magical answer to this. And, when we started looking at school planning around this pandemic, we have a crisis response in every district plan that we refer to. And when you get to the section on pandemics, it's not a very detailed step-by-step plan of what to do. So, we're doing our best to take the advice of health officials like Sanja just provided, and thinking through what areas we need to make changes. We've identified some very clear things, like Sanja said, about entranceways into the building, distancing, but then you take a look at like different age groups. So, what we do with kindergartners and first graders is a little different than what we do with maybe high school students because of the understanding and knowledge of how to handle protocols. And you need to have some more adult supervision and guidance for the younger ones. Things that we wouldn't even think of, like, until this hit is, shutting down all of our water fountains and, putting in water stations. So, changing our facilities around to meet, social distancing guidelines. Also, clearly safety things that are important to kids and our staff make a big difference.
Thank you for that, Charlie. One of the things I cued in when you were speaking was you mentioned about consulting with public health officials. One way I like to characterize our situation with COVID is to be successful, to be happy, healthy, and successful within this context is a team effort. And so clearly tonight we're illustrating that team effort with a superintendent and a scientist, but there's many other people on the team, which transitions me into the third question, which is, as I said, being safe in the pandemic takes team effort. once students and staff return to their school buildings, what can students and staff do to enhance everybody's safety in school? And I'll maybe ask Charlie to start. I'm sorry. We'll ask Sanja to start that question, and then we'll transition to Charlie.
Sure. And to say, Charlie, that you actually hit a very important point in your previous comment, and this is that there is no one thing that we can do to prevent transmission. There are going to be a number of measures that we will have to take, a sort of a hurdle approach to make sure everyone's safety. So I think it's important, and we talked a little bit about what needs to be done in the buildings, but it is really, as I mentioned, important to, in order to really understand what we have to do, go a little bit and scratch on the science behind the physical distancing and wearing masks and all these measures that will be required in schools. And I'll share my screen again because I have charts as any good scientist. So as I said, there is that disease triad, the interplay of many factors, and coronavirus is a novel virus. We only sequenced it like 10 months ago, and we're already learning a lot about the actual pathogens. We know what the symptoms are, and we know what is the symptoms to watch for, and this is going to be one thing that everybody is going to learn how to do, and learn what to look for, and learn where the resources are to help you do this in a proper way. So we know that fever, chills, cough, difficulty breathing, loss of taste and smell, sore throat is all these are known symptoms of COVID-19, the disease that is caused by this virus that's called SARS-CoV-2, coronavirus 2. And so in children, it is important to say these symptoms are going to be a little bit milder, a little bit CDC has a very good guidelines on how to go through a self-check, and I think both parents and teachers and staff and students themselves will have to be really well versed in looking into those symptoms. So many of our participants actually asked about what happens in children. Are children at lower risk of getting infection? Yes, they appear to be at lower risk than adults. Appear also to have a lower infectivity. Although anecdotally, we know when a kid is sick, they really leak, right? So they have very intense symptoms, a lot of discharge coming from nose and mouth, etc. It seems that their infectivity is at 85% of that of adult. However, they do get sick, and unfortunately, sometimes the kids also can pass away from the COVID symptoms, and we cannot have that. We don't want to have that in our schools. So there are some studies that say that kids approximately asymptomatic and symptomatic kids contribute to around 21% of transmission, but this study was done in Netherlands, and so their situation was a little bit different. I included here also a link to the full description of children as a children's role in disease transmission, if anybody is interested to learn more. Now, our goal in school is to prevent the virus transmission, right? And so to prevent virus transmission, we really need to know how does that virus transmit. Basically, it transmits via close contact. This is when a person who is infected, when they sneeze or cough, or even talk, sometimes even breathe, produce droplets. Those droplets land to the person who is not affected and is acceptable, and the person can inhale them and get sick. Close contact. When we cough and sneeze, we do not produce only big droplets. Big droplets are the one that transmit through close contact. We also produce very small droplets that travel far, and we call them airborne because they're aerosolized, right? And so they travel further, and we call this airborne transmission. And then finally, we have a fomite transmission, which happens when somebody who is infected coughs or sneezes. They cough or sneeze either in their hand and then smear it on the surface, or on the surface directly. Another person touches it, inhales it, touches their mouth or nose, inhales it, and gets sick. So that's fomite. And so if you see close contact, transmission is via droplets. Airborne transmission via droplets, and fomite transmission is also via droplets. So this is what we need to prevent, the droplet transmission. And to prevent droplet transmission, we are suggesting use of masks and of physical distancing. And those are going to be two critical interventions, not only interventions that we're going to be implementing in schools, but very critical ones. And as we said, masks really reduce the risk of transmission. They are effective to reduce the flight of large droplets, to reduce the flight of small droplets, so both close contact and airborne transmission, and to reduce the contamination of the environment, of the surfaces, right? And keeping away from somebody is going to ensure that we're not going to get sick, that we're not going to get high risk to get sick. And we say that minimal distance that we should keep away from somebody is 6 feet. And so where does that come from? 6 feet is approximately how far those big droplets travel once we sneeze and cough, right? In the situation when there is no air movement, we cough and sneeze, and droplets that are large, that carry viruses, travel 6 feet. However, the small droplets, the airborne droplets, travel further, and they travel as anywhere between 20 and 26 feet. So really the 6 feet distance is a minimal distance. 6 feet distance with a mask is giving us obviously more protection. This is, I included this picture because it's very telling. This is actually from my own work and from my own lab, where we simulated somebody's cough with a spray bottle, and then we use these Petri plates that have blood agar. The red one is when it has no bacteria, and we put the bacteria mixture, sprayed it to see how far these droplets that could carry pathogens can fly. And what we found is that without any barrier, they would go around 180 centimeters, which is about 6 feet, with no barrier. Now with barrier, we manage to reduce the contamination depending on distance up to 99.1%, right? So this barrier is actually, this barrier that we use was actual surgical mask. Now, a lot of times we think, okay, surgical masks work. How about the masks that we make at home? A lot of times they're going to be made from some homemade fabrics. So we tested that, and we found that if you see these graphs, they show the number of bacteria on the y-axis and the distance on the x-axis. And without any fabric, there's a large number of bacteria at each of these distances. When we use surgical mask, we reduce that significantly. And when we use different fabrics, we're going to reduce it in different levels. So the point of this graph is that not all the fabrics are created equal, and not all the fabrics are going to be effective, equally effective in preventing the transmission. So what we found here is that the most effective fabric is 140 cotton, just cotton fabric that is 140 is actually the weight of the cotton. The one that was thinner or less thread was not very effective. And jerseys, like if you're making masks from some sort of polyester materials, they might not be as effective as cotton. We tested, so this was interesting. If you see here the surgical mask and the double layered cotton made from even old t-shirts was pretty much similarly effective as a surgical mask. So when we're talking about resources, if you make a mask from even an old t-shirt, it is going to be effective. Okay, so now we modeled a little bit how does it look and what is the impact of people without mask in the room. And when we talk in school, we're thinking we're going to cut the density of kids, so we're going to have 15-ish kids maybe in the classroom. These are rooms with 10 people without mask, and let's say that we have 4 shutters in that room. Then we have 6 people more exposed to close contact, both close contact and environmental contamination. If some people wear masks, they're going to be less shutters, there's going to be less environmental contamination, but we're still going to be having the kids that are in close contact, and they're going to be exposed. So the best way to use masks as an intervention is when everybody in the room wears masks at all the times, in addition to social distancing. So I'm going to cut here just
Well, thank you so much, Sanja.
so that I don't tire people.
If I may, let me just highlight a few points that I heard, and then I'm going to transition to Charlie. So the first thing I heard is that everybody in the school building will benefit each other if they understand the symptoms and they regularly monitor themselves, so that if they are exhibiting symptoms, that they do not go into this environment and they get checked out by a healthcare professional. The second thing I heard you say that was really important is that children do contract this virus. Their symptoms tend to be milder, and they do transmit this virus to others. Again, it may be slightly lower rates, but they still contract it and transmit it. And to be clear, we have different groups of people in school buildings. We have students, we have staff, we have faculty, we have visitors that may be coming in for various reasons. And so while certainly children may get lesser symptoms and they may transmit it slightly lesser, there's other people in the environment to consider as well. We have to care for everybody in the environment. The third thing I heard you say was about how the virus is transmitted and the particle size and how those particles that come out of our mouths and our noses float and project into the air. And there was a nice little image that you shared that showed the different particle sizes, from a bigger particle to a littler one. And that little one, and I forget the exact size of it, but you could barely even see it on the screen, which is to say that a lot of these particles, we're not even seeing them floating in the air because they're so small. And then I think one of the things I really drew at the end of your remarks was that to have the most effective approach when it comes to the spread of particles, we need to wear masks. They need to be of a heavier weight fabric with a tighter weave. And we all need to wear them, not just some of us. We all need to wear them to maximally benefit from that protection. Did I capture those main points, Sanja?
Very good.
Okay, thank you. And so I'll now transition to Charlie, again, where the rubber meets the road in a school district, to talk about the same question about how this is a team effort and how his team and other teams in school buildings are planning to work with parents and educators and staff and students to make everybody safe.
Yeah, so Eric, the points that you made there at the end were in line with what I would recommend for schools. But, you know, the one thing I'd like to say about like Sanja's support here is I'm so grateful for tonight is we hear a lot of like what to do from healthcare officials. And I've had the luxury as a superintendent to sit in on conferences with our county board of health and some other health experts that can give me the why. And I think one of the biggest things that our faculty, our staff, our parents, and our students can do is understand the why. And so having Sanja explain not just what we need to do, but why it's important is critical, because we have a lot of people that, you know, there's a wide range of emotions around this pandemic. And, you know, from one extreme of I can't walk out of the house because I'm so afraid, to the other end of this is not real. And where we really get a better understanding through education and educating ourselves is through understanding science. So hearing what Sanja explained today, I think is beneficial for the people that are on this call. And I would recommend that if we wanted to do one thing for parents and other adults is educate ourselves on not just the what, but why. And then answering the question about like, what can we do to enhance this for schools? I think that we've got to be respectful of the procedures that are in place. The procedures that will be in place in schools were put in place to ensure the safety of all stakeholders that come into the building, used with the guidance from healthcare officials. And, you know, it's almost like, when people would say, maybe 15, 20 years ago, oh, I don't want to have to wear a seatbelt. There's no need to do so, but, in the end, nowadays, I think people would say, like, why wouldn't I wear a seatbelt? It might not prevent me every time I get in the car from dying. But if there's an opportunity that something bad could happen, it's a smart safety precaution. These health recommendations that we're receiving are very similar to that. It's not a guarantee that something bad is going to happen every time you walk out of a house or anytime you go to a school. But why would you not follow the recommendations and guidance of healthcare professionals so that we can be safe, not just for yourself, but others?
Thank you, Charlie. I appreciate your remarks about partnering with healthcare professionals, and that a lot of the challenges we're facing is just helping everybody understand the why, because if we understand the why, then maybe perhaps we can all buy in more to this team effort that needs to occur. Following on, Charlie, could you share a little bit about some of the novel things you might be doing in some of your school buildings that to help everybody be safe and cope with the virus? I know that every school district is unique, but is there anything you'd particularly like to share that's interesting or innovative from your point of view?
I'll share a little bit about our pathway to where we are today, and that's interesting in and of itself. So on July 10th, when the governor gave his guidance on what to do, and we worked with our healthcare officials to determine a plan, we developed over a 2-week period through feedback from parents, from teaching staff, non-teaching staff, from surveys, and just a bunch of questions. How can we make our buildings safe to come back in a hybrid model for our staff and our students and everyone involved? On the 31st of July, our county health department in Cuyahoga County came out and said they do not recommend that with the high level of COVID-related illnesses and deaths, and what our rate of daily rate is of contracting it, that they would recommend that we don't go back. And so at that time, we had to turn on a dime and make complete changes to the recommendation. And we're still in the midst of doing that right now in my district. And so, there's a lot of emotion again around, families trying to figure out how to take care of their kids and what to do, if we do remote learning, staff trying to figure out what do I do when I come back? So I'd say if there's anything novel, it's the fact that guidance continues to change and we can't be frustrated by it. We have to recognize that healthcare officials are not just making up new guidance. They're looking at the science, they're looking at data, they're making recommendations to help us provide the safe, best environment for our kids. And we need to respond appropriately, be able to shift because, we care about, educating our kids, but first and foremost, we want to make sure that we have a safe and learning environment for everybody.
Well, I appreciate your remarks, Charlie, from one academic leader to another. I'm the academic leader for a department, and we have well over 100 employees, and we serve thousands of students a year. And we like to have our routine. We like to be able to predict and know what's coming. And certainly as an academic leader, I can attest that we have to be much more agile and adaptive as the circumstances of the pandemic change, and it will, and it has changed already if you think about even just the past several months. And it'll likely continue to change over the next several months as infection rates ebb and flow and people engage in more or less social distancing. And it's tough. It's really tough. And I think that to the extent that we recognize that it's going to be ambiguous and that we have to get into this new pattern of accepting more change than we've had to accept in our educational enterprise, whether we're a parent, a student, or an employee, I think we're all better off if we come to that new understanding that things are just going to be changing and flexible for the foreseeable future, at least for certainly the next few months. So I'm going to continue on with Charlie, if I may, in our next question, because our next question focuses in on curriculum and instruction. So the question is, the majority of school districts are implementing flexible back-to-work plans that include in-person, hybrid, and online models of learning. And Charlie, as you just shared, you had one plan, which was hybrid, and then we had a change in the health status of your county, and now we're potentially moving into another mode of learning online. So my question is, what are the major human challenges that science and practice points of view can offer us, and what do you foresee in these different learning modes for our students and our educators and parents that are involved? How can schools and families partner to overcome some of these challenges of these different learning modes and opportunities of these different learning modes?
Yeah, so I'm going to go back first to March and talk about, we got flat-footed with no knowledge or expectation that we may be coming to a fully remote learning platform, and we adapted as school districts, and it was not ideal and optimal. In some places in my district, Maple Heights is 100% free and reduced lunch. We're an urban district, and there's a lot of challenges that come with poverty and mobility, and including lack of technology and internet connectivity. So the uniqueness of each district also contributes to what do we have to do to make sure that learning and curriculum and instruction are successful. One of the things that I know that many urban districts have been doing is trying to beef up and secure from other funders and foundations, as much support as we can for technology and connectivity, which has been a huge help. And I would just say to parents, when you look back at what happened in March, curriculum directors, school districts, school boards spent time in March, April, and May to say, if this continues, we must develop a better pattern of learning for kids. And so I can speak for the many districts that I'm associated with directly in my general area and across the state to say that I know that learning plans and learning platforms are much better now than they were in March and April. The expectation of kids learning on a regular basis and in a high quality level of instruction and support is being thoughtful from all of our districts to make sure that kids are learning not just at a minimum, but learning to learn with rigorous instruction. Now, with that being said, when there is online instruction, I don't know that it's going to replace the social and the emotional and the interactive situation that you see with direct instruction in the classroom and teachers and students engaging and working together where they can directly interact. but I do believe that it's strongly improved over the past few months. I would just say that communication with parents and with staff now is critical. If we're adapting learning platforms, and there's things that are not going right at home because we're not there, understanding what a child or family needs. In most districts right now with the governor's money have put in place like student support coordinators for social, emotional wellness and health. And I know there's strategies in many districts so that if there are issues that families are facing, we can help to work to address those as well. But the key, I believe, is communication, whether it be around the academic needs or the social emotional needs of our kids.
Well, thank you, Charlie. So I'm going to switch gears a little bit. I'm being mindful of time. I want to make sure that we get to some of the other topics that came out of the questions from attendees. One question is around food safety. And I thought that Sanja might kick us off here. So the question for you, Sanja, is what are your recommendations for meal delivery, food safety, and nutrition in schools?
Yeah, that's definitely my field. Sure, food safety is important, but I'll start by saying and re-emphasizing that COVID-19 is really not a foodborne disease. However, because we're so focused on COVID, we tend to forget some very basic food safety principles. Obviously, food safety is going to be important. Eating and consuming the lunches in school is going to present some of the challenge. If it comes to that kids are in school, eating lunches in joint areas is going to be challenging. So in that regard, the best recommendation now is to ensure that kids are eating, that students are eating in small groups, that the meals are pre-packed, prepared, that there are no lineups, no buffet style servings, to avoid salad bars, etc. And my favorite is food safety of fresh produce. I have to say, for adequate nutrition, we have to really encourage serving fresh fruits and vegetables, and fresh fruits and vegetables in schools. On that note, we know that fresh fruits and vegetables are consumed raw and they're not cooked, and they present somewhat increased risk for food safety. And we cannot forget, just because we have a new recommendations and a new strategies in place to protect us from COVID, we cannot forget the basic food safety measures, meaning proper preparation, proper refrigeration, and obviously hand washing. And some of these strategies and measures are going to be overlapping. Definitely hand washing is one of it. We know that hand washing reduces the risks for any infectious disease, and it's a very basic, very effective strategy. It's very, very difficult to enforce. So having to enforce hand washing in school environments, should the kids go back to school, is going to be one of the measures that is going to be improving our food safety and reduce the risk of other infectious diseases as well.
Well, thank you for that. And I'll just follow up with one clarifying question for you, Sanja. So on the one hand, I heard you say that COVID-19 is not a foodborne illness, so we don't have to worry about it from that point of view. But you also mentioned that there are certain kinds of ways that we deliver food that we ought to avoid, like buffets, as an example, or any kind of environment where we're passing bowls or otherwise using the same spoons to serve. And I imagine that's because of the contact that occurs.
And
right?
this is all these three ways that we transmit the virus: the close contact that we're going to avoid in the areas that are joint areas and the lunch areas, the fomite transmission that could be occurring when we're handling high touch surfaces such as serving utensils, etc. So yeah.
Well, thank you very much, Sonia. So I'm going to turn now to Charlie. And Charlie, I'm going to frame the question just a little differently for you, because I heard you say earlier that you're in the process of transitioning from a hybrid plan to a fully online plan. And then you also mentioned that that you work in a district that's 100% free and reduced lunch, which means that a number of your students are in some economically distressed situations. And I know that I've heard a lot of school leaders talk about the concerns that people have about students who qualify for free and reduced lunch not having access to healthy foods, adequate foods, should they not come to school. So maybe you could talk a little bit about how your district and maybe other districts are addressing the nutritional needs of students, particularly those that are in distressed situations, if indeed they're going to be 100% online to start the academic year.
Yeah, so that was a real big challenge for us in the spring because we did not have a lot of clear guidance, like Sonia just discussed with us about, packaging and the fresh fruits and vegetables, what climate they should be in and such as you're delivering. And so there were a variety of plans, from people putting food on buses and taking them to stops and giving them to families. As the more we received guidance, the more, and it aligned perfectly exactly with what Sonia said. I won't just be redundant in what she just described, but those all impacted our delivery system. What we decided to do was have stations at schools for breakfast and lunch that families could come and pick up multiple meals at a time. So if you were there at breakfast time, you can pick up a breakfast and lunch for your children. And for us, that is the key. I mean, if kids are coming from a highly poverty situation, sometimes coming to schools where they get their best meal of the day. And so for us to make sure that we continue to provide it, fortunately, through some programs for districts like ours, we were able to do that all summer long and continue into the school year. So our change from the summer till the start of the school year will be no different. We'll still have, our families understand that consistency now. So there's some regularity of families getting meals, which is beneficial to our district. You're muted, Eric.
Sorry about that. Thank you. As a time check, we have about 5 minutes left. And I just want to mention that we are getting some questions from the people attending this session. And one of them is related to something Sonia had spoke about earlier, which was face masks. In this case, the question is about the effectiveness of face shields, those transparent shields, in relationship to or in contrast to the face masks that you talked about, Sonia.
Yes, I see how effective are face masks. Crystal, thank you for the question. Face shields are effective. They're effective because they're going to not only protect your mouth and nose, but you're going to protect your eyes if you get exposed to other people's droplets. So they are effective. However, in children, the issue is that mask, when they have the masks on, the children would tend to touch their nose and mouth less. This doesn't happen with the shield. However, for the teachers, this should be a definitely required in addition to the masks, the face shield, or in situations when they cannot wear the masks, they could wear the face shield and have other similar physical barriers in front of their faces as they're facing the students. So I hope that answers your question. They are effective, but not as effective as face masks. masks in that preventing the transmission from a person who is infected.
Well, thank you, Sanja. With the remaining few minutes we have, I've been sitting here looking at the list of questions we've had, and one that I think we could touch upon that we haven't really touched upon yet is that as more and more school districts in Ohio are moving either to a hybrid, if not a fully online experience to start the school year, there are many parents who are concerned about how they can be most effective in supporting their students at home to progress in their learning. Recognizing that many of our parents, if not the vast majority, weren't trained as teachers, and recognizing that a large percentage of our households that have children, both parents, if there's two parents, both are working, or if there's one parent, he or she is working. And so I guess I'm going to turn to Charlie and ask, do you have any words of wisdom, any key points that you would share with parents to be effective partners with their children and with educators in this either partially online or fully online experience that schools will start with?
Yeah, you know what, and I'm going to use an example of something that happened to me today. I had a parent who called me and said, who emailed me and said, I work during the day, I can't teach my kid during the school day. How do I support them? And so I looked her number up and gave her a phone call and spoke to her about, as I mentioned earlier, the difference between what people experienced in March and what they're going to experience now. And I think that if people judge their experience in March on, I had to teach my own child, I had to help support my own child, I really believe that school districts have put supports and mechanisms in place to make sure that good learning and accountability and checks and balances are there. So reaching out, don't wait for your school to reach out to you. As a parent, get a hold of your school, get a hold of your teacher and ask, what learning platform are you going to be on? How can I access the work that my child's doing? What communication mode can I have with you to ensure that if you're doing synchronous, face-to-face online learning with my child, that my kid's not playing some computer game and they're really doing the work that they should be doing. So that communication, I think, is critical. And don't be shy as a parent, or don't assume that the online learning that you saw in the spring is going to be the same thing you're going to see now. Because I think in every district, it's going to be much improved from what we've seen in the past.
Thank you for those remarks, Charlie. And I'll just add to that by saying, especially for our students that are in the later elementary school years and beyond, don't underestimate how savvy they are with technology. As parents, if you just ask your own children to get online and show you what the school has to offer in terms of their online platforms, you might be shocked how savvy your students are on those online platforms already. They use them in the school during the school day in many cases, and of course, other districts are bringing new technology to bear in COVID-19. But another big resource are your very own kids.
Yeah.
I'm
going to actually add something, Eric. We, in addition to technology that is definitely very helpful and really tied us over in March, and it is very, very hopeful to hear Charlie say that the teaching approach is going to be even better moving on in August. We are developing, and we are developing modules that are going to have the flexibility of whether they're going to be implemented in schools or at home, and modules that are low tech enough that can be used in any household, regardless of the technology level or socioeconomic status. I am going to mention only one. We have developed an experiment on the effectiveness of face masks that can be completely done at home with home ingredients. So this is in press and should be published within the next week. The link to that module that is going to be open access will be published as well on my slides, and I will communicate with the administrator to ensure that everybody gets the slides that they saw today, with additional links for resources. I also want to say that at The Ohio State, there are a number of scientists that work on the pathogen, on host issues, and on environment. And I know that your schools, districts are doing their best to make sure that the students are getting high quality learning, even in this environment. So on that note, we're going to adapt to this and probably go through this together.
Well, I appreciate those remarks, particularly ending on a note of hope, Sanja. I think that this conversation clearly shows that our professionals are engaged and supportive of our communities, that we are and will be adaptable and resilient in the face of this challenge, like we have faced many challenges before as a community, a state, and a nation. I want to thank you, Sanja. I want to thank you, Charlie, for contributing to our community this evening in this way. I want to thank, again, all of the staff behind the scenes that made this session possible and ran very beautifully, so thank you for that. And I want to thank all of our attendees. If you have any further questions, you have ways of contacting us through your registration process. So please feel free to reach out to us at any time. We'll be happy to support you in whatever ways we can. And we look forward to future sessions that we'll be offering on these topics to continue to support our community. So thank you all for joining, and have a great evening.